A very good evening. Hope I'm audible.
Yes, sir.
Yeah. So I'm Dr. Khaleel Ahmed, MS MS FRCS Ophthalmology, Director of Anurai Hospital. Really nice to interact with you. I hope it's an interactive session and useful to you. Uh, just a few updates about our services in cataract and refractive surgeries. We know that cataract is one of the very common di- disorders which causes loss of vision and progressive decrease of vision. In olden days, people used to undergo cataract surgery, which is called intracapsular cataract extraction. Then came extracapsular cataract extraction, and then we used to have make a big incision on just next to the cornea, that is called the limbus. We used to make an incision about 8 millimeters, 10 millimeters, and remove the cataract and fix an rigid intraocular lens. And put many sutures, about 5 to 6 sutures usually is required, and those sutures sometimes cause irritation, and they become loose. Sometimes we have to remove them, and this process used to go for a long time. And the restriction used to be for having bath and resuming normal activities, going for the job used to take a long time, a couple of months. But now the technology and the techniques have far developed, and now people also are more demanding, and they require perfect clarity. It is more of a refractive surgery. Cataract surgery is now a combined refractive surgery too. People want to see clearly, distance, near, without the glasses, and the expectations also are very high. And now the surgery which are performed by phacoemulsification, that is just a 2 to 3 millimeter incision. We do the pinhole cataract surgery, and with the phacoemulsification probe with ultrasound energy, we just dissolve the cataract, make it into small pieces, and suck it out, and place an foldable lens inside the eye, and the foldable lens opens up and it gets set in the natural position. And within 5 days, the person can resume all normal activities, go back to work, have head bath, cook, and do everything absolutely normally. And then the kind of lenses which are now available, we did not the accuracy of the preoperative scans, that is called the A scan, that's called A scan biometry, or and the IOL master scan. So with these tests, we calculate the power of the lens which is required, and we place the exact power, which is usually good for the distance in monofocal lenses. And supposing there is even cylindrical power, that also is corrected with toric lenses. Supposing the person wants distance and near without glasses, we can implant multifocal lenses, trifocal lenses, and trifocal toric lenses. All these are possible, and the patient is absolutely spectacle free, independent, and even supposing there is already cataract has been done, already a lens has been implanted before, or it can, and they want multifocality, or there's a residual power, an add-on lens also can be implanted. It's, and supposing there is no lens implanted, like surgeries which they underwent more than 30 years ago, there was no intraocular lens invented at that time, and these patients can secondarily go undergo in surgery and implant the lens. So this is about the a brief about the cataract surgeries. And going on to the refractive surgeries, people who do not want to use the spectacles, they can undergo the refractive surgeries. Where usually young people who for alliance purpose and for marriage purpose, yeah, they undergo the surgery uh, and become spectacle free. And otherwise, also many people are totally dependent on the glasses. Once they wake up, they have to really search for the glasses and put it on. And they are really dependent on the thick glasses which they're using. And totally it can be eliminated. Even the plus power also can be eliminated, and even the minus powers also can be eliminated. Cylindrical powers also can be eliminated, and they can be totally spectacle free. There are a lot of options in refractive surgery. We have LASIK surgery, where the cornea is a small, very thin flap is made on the cornea. The cornea is surfaced with the laser. The laser shoots automatically according to the power which is required, and then the flap is placed back. It's just about a 5 to 10 minute procedure. Both eyes are done at the same time, and the patient is on the day of surgery. He or she may have some kind of irritation, but the next day they are totally, you know, they have the wow factor. They are able to see again without glasses. That in first time in their life, it's they have a real great experience of with that. And sometimes when LASIK is not possible, or the cornea is pretty thin, we have a special procedures called epilassic procedures, and that is a surface procedure. We don't take the flap, we or just take the superficial corneal layer, that is epithelium, and we do the laser, and we preserve the corneal thickness. And femtolasic, that is a blade-free LASIK surgery, that's also a very new advancement. Now, the people who cannot go undergo the LASIK surgery, people with power with more than -7, -8, and they need and with a cylindrical power, and these patients we can go for an ICL, implantable contact lenses, and these contact lenses are really uh, very simple. We just place the contact lens in front of the normal crystalline lens, and the person again has an wow factor, and they are able to see again very clearly. So these are the and there is an option of for people who are above reaching 45, 50. They have a little bit of cataract developing. So these people, instead of going for an ICL, they can go for a refractive lens exchange. I had a patient who had a plus power with the clear lens. He didn't have cataract, but he was dependent on the glasses for distance and near. And he said, I want to be spectacle free. So I did refractive lens exchange. He was in that age group, they around 45, 50 years, and I did a refractive lens exchange. And these people, the advantage is that in the older age, they don't require the cataract surgery because already the lens is exchanged. So these are the new advances in refractive surgeries. And now, for even for presbyopia, that is the people who require the reading glasses, we can even avoid the glasses with the uh, with special lenses, these ICL lenses, which can be suitable for reading alone. So these are the newer advances in refractive surgeries. And and we go on to the glaucoma. We have a lot of people having glaucoma, and they're not diagnosed at time in time, and the increased eye pressure, which is usually normally between 10 and 20 millimeter mercury, it sometimes it's goes very high, and it causes pressure on the nerve cells of the eye and neurons, and it causes damage to the optic nerve. And certain areas of vision get dim, the field of vision gets dim, gets affected. So this thing needs to be detected early, treated early. And how do we know that we have a glaucoma or don't have glaucoma? It is only by a comprehensive eye checkup by an ophthalmologist. The ophthalmologist, they check the eye pressure, they check the vision, and the angle of the uh, drainage of the aqueous that is in the eye. The fluid is being formed, that is called aqueous humor, that is just behind the iris. It flows through the pupil, and in front of the iris, it gets absorbed, it gets drained. So supposing the production is too much or the outflow is blocked, the pressure can go high. So we check the outflow angle, whether it is blocked or not. That is called gonioscopy. And then we do the field analysis, that is called through the field analyzer, automated field analyzer. And we do OCT of the optic nerve, so we can really objectively record what is the kind of damage which has occurred in the optic nerve, and we can assess it progressively, whether it is progressing, whether it is stable, and we can assess and adjust the medication accordingly. Sometimes, usually the patient is treated with drops, sometimes with a laser, supposing the angle is very narrow, the outflow angle is very narrow, a laser peripheral iridotomy, that is called laser PI. With that, we can treat the glaucoma. And if sometimes when the pressure is too high or the optic nerve damage is too much, then we go for the glaucoma surgery. And there are newer devices called orogen implant, which can we can assure, we can the drainage of surgery to be effective for many years. So this is but all the damage which is already occurred due to glaucoma, we cannot reverse it. Of course, we can prevent further loss, and at least the lifespan of the person will preserve some vision, useful vision. That's what our aim is. And the, uh, we have to really check our eyes. If once we are more than 40 years, we really need to check our eyes. And even the frequent change of glasses, the change of power frequently, that also can be a indication of glaucoma. Yeah, there will be no pain. The vision loss will be so slow and so in one eye, but the other eye will be covering up that area. The person will not even realize until the last stages that the vision is and the optic nerve is so much damaged. So basically we have to screen ourselves, we have to go to an ophthalmologist regularly and get it checked. Now this is an outline of glaucoma services and glaucoma treatment. And now we'll touch upon diabetic retinopathy, because diabetes is really, the number of people getting diabetes is really increasing day by day. A huge population in our country and around the world getting diabetes. And this diabetes, if it is uncontrolled and lasts for many years, 10, 15, 20 years, some organs get affected, the kidney, the nerves, the arteries, and even the eye. So eye is this special and a unique structure, which where we can see directly the blood vessels. Yeah, there is no without there is no other organ unless we cut open to see the blood vessels. But here we can directly through the slit lamp examination and the special lenses to see the retina, we can see the blood vessels, the status of the blood vessels, how good or bad they are. And if they're due to diabetes, the blood vessels get weaker, leak some blood, and small hemorrhages appear. So that is called diabetic retinopathy, and we got to check it early. We got to also treat it early to prevent complications. How do we treat it now? Now one is the laser. Our diabetic consultant. We have a diabetic medical retina consultant, very experienced professor, and we have a surgical retinal surgeon who is very good in his work. They take care of the retinal issues. Timely laser is important, and supposing the retina is swollen up, that is called retinal macular edema. So then to reduce the swelling and to improve the vision, we give injections in the eye, and those injections are called anti-VEGF injections. So these injections cause the bleeding to come down and the swellings to come down, and improve the vision. And but the diabetic control is very, very important. So basically, the lifestyle changes for to prevent diabetes and to get diabetes in control. Basically, we got to have a very active lifestyle, daily walking, and diet restrictions and regular medications is very important to prevent diabetic retinopathy. And the supposing the patient gets into complications, suppose the vitreous hemorrhage, and such things that do happen sometimes. So then we got to do a surgery and clear up the blood which is collected behind. Sometimes the retina gets detached due to the fibrous bands there which contract, and the all this is set right, and the retinal detachment is again settled back in the retina is settled back in its place by use of special gas or oil. And so now the patient regains and recovers the vision. So these are the common eye ailments which I like to touch upon. Now, a small thing about oculoplasty. What is oculoplasty? This is the specialty which I have specialized in All India Institute, Delhi. This refers to everything around the eyeball, like the eyelids, the tear drainage system, no, the lacrimal drainage system, and the orbit. So where the socket where the eyes are placed, all these things are called are related with the oculoplasty. So sometimes there's too much of twitching in the eye, and there's so much of twitching in the eye that the eyes get closed involuntarily. Both the eyes are get closed, and they're practically blind for some time. So when this happens during driving or some crucial work, it gets dangerous. So there are some injection called Botox injections. We do the Botox injection, and and relieve the problem. And supposing the eyelid is not able to close, that is called lag ophthalmos. Supposing there's nerve paralysis, the eyelid is not able to close. So I did a very unique surgery called gold implant in the eyelid, and through the weight of the gold weight in the eyelid, we the eyelid used to close and open. So the patient was really happy, and we could save the cornea from getting dry and damaged. So these are the unique surgeries which I have performed. In cataract, very rarely we have a congenital cataract. By birth, the child is having cataract. So we have to treat it very early, because the initial age, that is the initial few years of life, is where the retina is really stimulated, and the retinal and vision development occurs very much. So these crucial years, if the vision is deprived, then what happens? The child gets the nerves of the eye gets weak, so that's called lazy eye or amblyopia. So that we have to treat very early. I have performed surgery on a 4-month-old baby who came from Sri Lanka, and this baby, yeah, is now about 10 years old now, and is doing pretty well. So this and even the squint, sometimes if the child has squint, the brain takes up the vision of the straight eye, but avoids the vision from the weaker eye. So this eye which is weaker, which is deviated, which has squint, gets doesn't really develop, the vision really doesn't develop, and again the same problem called amblyopia or lazy eye can occur. So child screening the children is also very important, because children may not know that they have weak vision, low vision in one eye. They think, unless they close the eye and see with one eye, they don't realize that they have weak vision. The children sometimes who have myopia, they're not able to see the blackboard, and the teacher thinks that he's inattentive and copying from the neighbor. And and these children become introvert, because they cannot play outdoor games, they cannot see far away, so they become introvert. They have a few friends, and sometimes the plus point is they are good in studies, but reading always the books, but then they don't go out and interact and play outdoor games much. So these kind of mm, uh, psychological problems also do occur due to eye problem, and this has to be taken care of. And the people who have cataract in old age, sometimes due to fear or due to some other reasons, they don't get operated, and because of their low vision, sometimes they trip over and fall, and they get end up in some fractures. So these things, have to be taken care of very early. Yeah. And as we know, the eyes are the, the windows for the whole world. We recognize people, we enjoy the nature, and the eyes are one of the most important organs which God has bestowed and gifted us. So it's our utmost duty for us to take care of our eyes. And now we have Deepavali coming. We must be very careful in bursting the crackers. Of course, it will be best if we avoid bursting the crackers itself, to reduce the noise and the air pollution, because now due to the pandemic, people are having breathing difficulties, especially the people who are recovering from the COVID. So it will be best to avoid. But even if we do, we must be very careful, especially with the children. If they are not supervised, it's very dangerous. Sometimes if the bomb, the blast really unpredictably, and the small pieces get into the eye and damage the eye. And if it is mild and superficial, it is of course treated easily. We can remove those foreign particles. But otherwise, if the injury is too much, then it can get into the eye and really damage the eye permanently. So for ourselves, and also especially for the children, supervision is very, very important. Yeah. So these are the few tips. which I would like to share with you, and I hope we could have an interactive session and questions coming up. I would love to answer.
Thank you so much, sir. Yeah, there are one question asked by Ibrahim Mohammed.
Yes.
Assalamu alaikum, sir.
Welcome, salam.
Uh, Doctor, actually, I am using specs almost 20 years. Is this possible to live without specs in upcoming days?
The you are having specs, which is what is the power of the specs, and how old are you?
Sir, sir, he is using specs, sir,
Yeah.
almost 20 years, sir.
Okay.
So, because of sir sight problem,
Yeah.
so he is saying that is this possible to live without specs in upcoming days?
Without the specs, yes, but we can do a refractive surgery. Definitely, we could do a refractive surgery, and you will be spectacle free. We can we will first assess your eye, the corneal thickness and the corneal architecture, and we will decide on which refractive surgery is best suitable for you. And with a refractive surgery, definitely you could be spectacle free for the rest of your life. But without a refractive surgery, it is not possible. Usually not possible.
Sir, he is saying it is -1.
Okay, okay. And what and his age?
Sir, age is near about sir 40 years, sir. 35 to 40 years, sir.
Okay, okay. So -1 is not a big number. -1 usually you're not dependent on the glasses. You can even be without the glasses. And one advantage is once you're 40 and 45 years, the plus power comes in. That's called presbyopa. Plus power comes in. So this plus power will compensate with your minus power, and you will be spectacle free for near. That is a it is a blessing in disguise. When you're 45 years age, your friends who are in the same age will be using glasses for reading, but you will be spectacle free. You will be able to read without your glasses. So for you, the refractive surgery may not be an ideal thing, but we just wait. Things will get better.
Thank you so much, sir. Thank you so much
You're
from
most
all
welcome.
patients, sir. There are near about sir 60 to 100 patients are seeing your streaming, sir.
Excellent,
Okay, so
excellent.
people are very happy and they are saying nice lecture, awesome, very good comments, and all are saying assalamu alaikum, good evening, sir, and thank you so
Yeah.
much, sir, once
Walaikum
again, sir.
assalam. Good evening. Nice
Thank
day.
you.